Carrie and Catherine here. We should take it away.
Right. Well, hello, everybody, and welcome. Today we're talking barriers and facilitators, and why does Childbright keep talking about them? So we're going to get started right away with a land acknowledgement. So I wanted to acknowledge that I am joining today from Treaty 1 territory on ancestral lands, the traditional territories of the Inuit, Anishinaabe, Ithinuak, Anishinaabe, Dakota Assiniboia, and Denusaline nations, and on the homeland of the Red River Métis. As a white person who has come to this land by choice, I want to acknowledge that I have privilege based on the color of my skin. I appreciate all the custodians of this beautiful land, both past and present, where I live, work, and raise my family. As a national group, I know we have people joining us from many ceded and unceded places. Please take a moment now to honor all the people, both past and present, who have walked this land and protected these waterways. I do want to acknowledge the harms and mistakes of the past, and that these harms continue into the present day. I do hope to move forward in the spirit of reconciliation and collaboration in my work, in my community, and in my life. And I am always learning. So I do welcome feedback on my words and my work at any time. You're welcome to let me know. You can chat me, or you can also reach out to Pierre, and Pierre can make sure I get the information. I will pass it over to Catherine.
Thanks, Carrie. So I would also like to begin by acknowledging that I'm speaking from Tiohtià:ke, also known as Montreal or Montréal, which is located on the unceded traditional territory of the Ganagyaga or Mohawk Nation. And as an island, this land has long served as a site of meeting and exchange among many First Nations, including the Ganagyaga, Huron-Wendat, Abenaki, and Anishinaabe peoples. So we would like to officially welcome you to this implementation series about barriers and facilitators. So my name is Catherine. I'm a former postdoc with the Childbright Network, where I was working and learning with Stephanie Glegg at UBC. And since September, I've been back in Quebec, now based at the University of Quebec in Trois-Rivières.
I'm Carrie Costello. For this particular talk, I am mostly wearing the hat of a co-primary investigator and a parent partner on the Bright Coaching Project, which is one of the Childbright current implementation projects. And the plan for today. So how did we get here? So we're going to talk a little bit about that. Why barriers and facilitators? Why focus on them? We're going to talk quite a bit about the Consolidated Framework for Implementation Research and how we're using that, and some examples from the two projects that Catherine and I are working on. I'll pass it back to you, Catherine.
So before we jump into the presentation, we just wanted to follow what Celia and Simone did last implementation series presentation and take a moment to introduce ourselves and share how we got interested in implementation science. I'm just going to put everything on this slide there. Okay. So for me, I always knew that I wanted to work in healthcare. And as I was exploring the different programs that were available, I became really interested in occupational therapy because it's such a broad field that touches on physical and mental health across many populations and practice areas. So for somebody like me who has a lot of different interests, it seemed like a good fit. And after graduating, I worked briefly in mental health, but then transitioned to pediatric OT, where I stayed for the rest of my clinical career. And during my training, there was a lot of talk about evidence-based practice, using the literature to inform what we do and how we do it. But in the real world, I found that practice often didn't reflect the evidence. So that experience pushed me to go back to school. I started with a master's, then a PhD, hoping to better understand and maybe try to bridge the gap between research and practice. So then for the next few years, I balanced or tried to balance being a graduate student, all while working as a clinician. And along the way, I got involved in more and more research and quality improvement initiatives, mostly at Interestin, where I was working at the time. And when I finished my PhD, I wasn't exactly sure what I wanted to do next. So stay in academia or go back to more a clinical researcher role. But as I was leaving on maternity leave anyway, I decided to just take the year off and take the time to decide what I wanted to do. And all I knew was that I wanted to have a role that would allow me to contribute to improving the rehab practices and the health services we provide to children. And that's when I came across the Childbright postdoc opportunity. And I remember reading through the descriptions of the different projects, seeing the PI's profiles, and learning about implementation science. And for me, it just kind of clicked. I had like this light bulb moment of this is what I want to do. Because I want to be a researcher, but I really want to conduct research that is really grounded in making changes happen in the real world. And also as a clinician, I was very drawn to the patient-oriented research, so working closely with children, families, and other partners to make sure our work truly has an impact. So that's why I decided to join the Childbright Network. And now I wear a few hats. So I really enjoyed my experience with Childbright. So I've stayed involved in the Parent Voices project, which was my postdoc project, and also the knowledge mobilization program. I'm also now a new assistant professor, learning to lead research projects, teach, mentor students, and juggle everything that comes with this new role. And of course, I'm also a person outside of work. So I have 2 daughters. I'm currently pregnant with a baby boy due this summer. I love running, reading, traveling, and many other things.
Okay, over to me and my journey to implementation science, which starts with puppets. Well, I don't know. I don't know if that's where it starts, but before I started on this journey, I was a puppeteer and playwright for young audiences. That's where I began. I have 3 wonderful kiddos. This is last year. And my middle kiddo is the reason that I'm involved in Childbright as a parent partner, and the reason that I got involved in engagement, patient-parent engagement from the beginning. You can see the arrow coming from her brain because Ale has a diagnosis of a rare genetic disorder called beta propeller protein associated neurodegeneration. We did not know that until about less than a year ago, but that has been the cause of all of the sort of ongoing rehabilitation needs and issues that we have seen. So, but back before we even knew what the problem was, we knew there were problems, but we didn't know what the reason for those problems were. There was a call that just came from the rehabilitation center that we were connected with for Bright coaching for parent advisors. And I went, great, I wish I had that. We did not have that. And the wait list was not a pleasant place to be. So I signed up. And that was my first, so 10 years ago now, that was my first engagement opportunity. I loved it. We had great, wonderful people engaging with our group. That brought me to sort of work more in engagement. I had a full-time role in engagement for about 2 years, 2.5 years. But research is slow and parents got frustrated. Again and again, we would sort of find that parents would drop off in 3-4 years, especially as they found out that there was no plan for how to actually get it into practice. So when a couple of projects, including that I was working on, a type 2 diabetes project and the Bright coaching, were both sort of forced to sort of move towards implementation, I went, okay, well, I better figure out what this is. So I took all the time I could possibly find, some of it through ChildBright, some of it through CanSolve, which is the other network I was involved in at the time, and went, great, let's actually try and solve this problem. And there's a whole science around it. That's great. So I took a lot of training and spent a year and a half working with the Center for Implementation. I've now moved on from that role, but I certainly learned a lot about how much more complicated it is to try and implement things to actually make change. So the hats I wear, lots of them: co-primary investigator, co-investigator, parent partner, parent lead, depending on what project I am involved. I have my fingers in a lot of different projects, and I kind of love that. My current full-time role is a community engagement manager for Gakanoa Mage Teach for Canada, which supports educators to go teach in the North. And then I am a level 1 implementation support specialist. I am also a parent, a wife, sister, daughter, friend, advocate. I play in an old lady soccer league once a week. And yes, love research, love working on different projects and learning all the time. So we have a quick polling question for you, and Pierre's going to put that up just to get a sense of where we are. So please, if you could fill out that poll, that would be great. Okay. All right, I think we've got most people there. Pierre, we can share the results. Okay. So really, a lot of us are somewhat familiar or have a general understanding, which is great, because we will be sort of jumping into actually how we do things and do things at different levels. So thank you for that. Okay. So barriers and facilitators, why do we keep talking about them? Well, the main reason is because if we don't get these right, then the rest doesn't really matter. Because if we don't have our barriers and facilitators correct, if they are not correct, then everything after that, like picking our strategies and trying to evaluate them, doesn't really matter. Because if we're not picking strategies that will actually fix the barriers, then it's not going to work no matter what we do. This is also the step where we are most likely to make assumptions. This and the picking strategy step, but because we think we know. We think we know as a research team, as clinicians, as people, as parents, we think we know. And all of that is good. That is part of the process, is to talk to those team members, but then actually talking to the people on the ground who are going to have to implement this really is important, because we can make assumptions. And sometimes if those assumptions are wrong, again, back to point one, if we don't get these right, the rest doesn't matter. And one thing I always want to highlight is facilitators. Don't forget about facilitators. We often do, but they are so important because they can help us fix some of the barriers that we find. We can really leverage them. So we'll talk a little bit about that. So now into the chat, I would like you to just type a barrier. This can be from a formal project or just a guess, something, anything. Like, what do you think? Any barrier that you can think of off the top of your head? Finances, yes. Funding is always a big one. Yep, absolutely. Thanks, Heather. Time, not enough time. Yep. Being overwhelmed, stress, burnout, SDOH. Uh-oh. Alifa, you might have to explain.
Social determinants of health.
Thank you. Okay. All right. Competing priorities, absolutely. Health, human resources, all of those are absolutely great barriers. And so really, thank you for those. Oh, here we go. And really just making sure that you are digging deep. So it's easy to say human resources. Okay, great. That is a barrier. But what is the why behind that barrier? So really digging down to, okay, human resources is the barrier, but why is human resources a barrier? Is it because we're not graduating enough doctors? Is it because there's not enough schools that are offering these degrees? So really digging down into the why. It's really easy to kind of stop at the surface level and like, oh, I don't think that'll work here. Well, but that doesn't actually help us. So like, why don't you think it'll work? Is it, you can dig down. It's a culture. They don't have a culture of making change. It hasn't been positive in the past. They've had negative experiences in the past with trying to make changes like this. So all of those will help you really dig down into those barriers. Okay, facilitators. All right, put those in the chat. What are some facilitators you can think of? Sometimes this is harder. Clear communication, coordinators, yeah. Staff, low-cost project implementation, people, team members. Yeah, passion. Passion is super important. It's true. We'll talk about that in a little while. And this is just, we tend to think of things, we tend to hold on to the negative, we tend to remember the negative, and this is us and also the people we're going to talk to in trying to implement. They're all going to have a little bit of that negativity bias because it's just built into us so we didn't get eaten. But in implementation work, we really want to try and get both the positives and the negatives, because both will really help make it work. So really making sure we're working against that negativity bias as much as we can. And there's the science part of it, but implementation is by nature human and relational. So really just making sure that you understand the dynamics of the people in organization. So for example, here in Manitoba, the Rehabilitation Center for Children is funded to do certain things like diagnosis, like preschool age therapies, things like that. But like coaching doesn't fit into that. So knowing that dynamic, we need to figure out, okay, how do we fit into that? Or how do we create something beside that can support that work? Sort of that's kind of things. If you don't have a relationship with the people who are implementing it, you kind of need to start there. Because if you don't have that trust, you don't have that working relationship, you need to get started on that and making sure you really know who you're working with and how you can make this work for both parties, for both organizations, for both people, because the relationship and the back and forth needs to be very clear. So how do you collect them? You can do them formally or informally. A lot of that may depend on what you want to publish and how much you want to get through ethics, because certainly people do quality improvement all the time. That is sort of a bit less formal, but even if you're doing an implementation project, you can collect barriers and facilitators in sort of formal and informal ways. There's some of them there. Then what do you do with them? I like to think of it as like throwing things in buckets. So like taking little quotes and chucking them in buckets. So the funding bucket, the policies and laws. And this is just to see what really are people's priorities and what really are, instead of our assumptions of what they are, what really are they? So talking to a bunch of different people. So I'm gonna pass it off to Catherine to talk about what these buckets are, these theories, models, and frameworks that I'm just sort of going, chuck it in a bucket, in a little more detail. Take it away, Catherine.
Thanks. Yeah, so I will take it away for the most exciting part, which is the theories, models, and frameworks. But don't worry, we'll just give a brief overview, not to bore you too much. Okay. So for most of us, I guess this model that we see here, which is the knowledge to action model, should look familiar. It was introduced in the previous session, but I've only included it here just to show that the different models, theories, and frameworks that we can use, some will apply to specific stages, and while others can be used across several. But today, for this presentation, we'll just focus on the assessing barriers and facilitators to knowledge use phase. So as you can see here, there are a lot of different theories and frameworks we can use. So just some examples. For the theories, we can use a theory that explains the mechanism of change, like the combi, or we can use frameworks that will describe the different categories of factors, like the buckets that was showed earlier, that will influence implementation. So today for this presentation, again, we'll just focus on one framework, which is the Consolidated Framework for Implementation Research, the CFIR, because both Carrie and I have used it in the past and are currently using it for our project related to Child Right. And just as a reminder, a framework provides a structure and categories to describe what's going on. So it doesn't explain why something happens, but it helps organize the different factors and concepts. And the CFIR is called a determinant framework because it means that it helps to identify factors that will influence implementation outcomes and also understand why something might succeed or not, so it might fail in a particular context. And again, something that was said in the previous session, the goal is not to pick the best framework or the best theory. You really have to pick the one that works for you, for your context, and for your project. So don't just use what everybody else is using, choose what fits. So it's not because we present the CFIR today that it's the one that you have to use for your own projects. So if you've used CFIR in the past, you have possibly worked with the original version, but know that there's now an updated version, which is the CFIR 2.0. And today we'll just focus on this one. It's very similar to the other one, but it's a bit improved based on the feedback received from people who had used the framework in their work. So the CFIR is one of the most frequently cited and used implementation science framework, and it consists of 5 major domains. So the 5 major domains are represented in the 5 circles that you can see here on the slide. So there's the innovation in the center, and then the individual, the inner setting, the outer setting, and then the process. And each domain will include specific or smaller categories that will help you map out the barriers and facilitators or put them in buckets. So as you can see here, you would choose the CFIR for your project if you have multiple layers. So if you're interested, for example, in barriers and facilitators that relate to the individuals that are involved in your initiative or project, but also the context and also the innovation itself. So if I can just give you a quick description for each one of the domains here. So by innovation, what they mean is the thing that is being implemented. So it could be a new tool, a new practice, or a new intervention or program. And then as you can see, you have different constructs that explain the different aspects related to this innovation. Then for the individual, there's like 2 overarching themes. So the roles and also the characteristics of the individuals. So this domain really helps you to identify all the roles that are applicable to the implementation initiative. So usually the person will be either a recipient of the innovation or delivering the innovation. And also it helps you to define who are the people involved. After we have the inner setting. So if you take the example of a hospital, then the inner setting would be the hospital center itself, but also the different departments or program within the hospital. They can all be considered the inner setting, and then you can have multiple inner settings. And as you can see, there are a lot of different little constructs within the inner setting. And some of them apply to the setting regardless of the implementation, and such as, for example, here we have structural characteristics. So the way the inner setting is set up. And also we have other constructs that are more specific to the implementation initiatives, such as, for example, compatibility or available resources. So what's in place or not that can support the innovation that you want to implement. Then we have the outer setting. So that's the broader system outside of the organization. And just like the inner setting, there can be multiple outer settings. So one example, very easy, would be something like COVID-19. So it happens in the outer setting, so outside of your organization, but it still has an impact on your work or your implementation effort. And finally, the last domain is process. So it's defined as all the activities and the strategies that you will use to implement the innovation. So now I will move on to the different projects within ChildBright that have used this framework. So I will talk about the Parent Voices project, and then Carrie will talk about the Bright Coaching project. So the Parent Voices project, just really in a nutshell, we are trying to shift how outcomes are measured for children born very preterm during neonatal follow-up visits. So instead of having a meeting with your doctor or the nurse that is solely focused on medical outcomes, such as diagnoses, impairments, deficits, we really want to shift the narrative and then capture things that are more meaningful to parents. So for example, function, participation, quality of life, and also measure it from their perspective. So our goal with this project is, let me just make it appear, is to have the NFUPs here are clinics, so neonatal follow-up clinics. And we have approximately 24 clinics that are part of a larger network across Canada. So we want those clinics to adopt two new prompts here are patient-reported outcome measures. So we want to have them use those new patient-reported outcome measures that will measure function and participation and quality of life and will be completed by parents as part of standard clinical work and also research data collection. So as you can see here, I've included the goals of our pre-implementation phase. So identifying barriers and facilitators is one of our goals with this study. So if we also, going back to the CFIR, if we map this to the CFIR, so our innovation here is the new patient-reported outcome measures. The individuals will be both the clinicians who will be delivering the innovation and the parents who will be the recipient of the innovation. The inner setting will be the 24 different clinics that we have across Canada. So like I said before, we have multiple inner settings. The outer setting will be the network. So the CFIR network, which is a network that kind of links all the different clinics, in addition to, for example, the health system, policies, things like that. And then the process of how we will do that is really to embed it in clinical practice and also the research data collection that we do part of through the CFIR network. So this is our study timeline. So as you can see here, we will collect barriers and facilitators in two phases. So the first one was done last summer, fall. So we did it using a survey. And we wanted, at this stage, we wanted to identify early stage barriers and facilitators, because we're still trying to define exactly what our innovation would be. So the barriers and facilitators that we collected at this stage were more related to the innovation itself and was more exploratory. And then we collected this winter through interviews with parents and focus groups with clinicians. We did collect, again, barriers and facilitators but really those that related to the other domains. So mostly individuals, the context, and also the process. And how exactly did we collect them? So as I said before, we used, you can see here, the individual interviews, the focus groups, the surveys, but we also looked at the evidence. So without conducting a real, for example, scoping review, we still went to see what was available in the existing literature. And also, as we are using an integrated knowledge translation model for our research project, we had a lot of engagement activities and meetings with the different partners. So we met with parent partners, clinicians involved in the network. We also do an annual updates, workshops at our annual conference. So we do have a lot of informal conversations around barriers and facilitators that we still consider when we analyze all this data. So like we said earlier, frameworks like the CFIR will help organize and analyze our data systematically. So here's an example from our survey. And again, going back to the bucket analogy. So here on the sticky notes on the right, you can see each sticky note is a barrier or a facilitator. And we mapped each of them to one or more CFIR constructs. And what you see here is just for the innovation domain. So we did the same exercise for the 5 different domains using the results that we had from the survey. And I'm not going to discuss this much because it will be the focus of the next implementation science series presentation in June. But then the next step will be to use another tool, which is showed here, called the CFIR ERIC matching tool. So once we select what our high priority CFIR constructs are, we can use this tool to receive a list of implementation strategies that we know are effective to address those barriers and facilitators, according to experts and the literature. So an example that we often give is education. So education is kind of the go-to strategy that everybody wants to use. But what you realize when you really do that exercise is that unless lack of knowledge is a major barrier for your specific initiative, then you probably don't need to educate people. So this process here really helps you choose effective strategies, not just ones that are familiar. And so finally here, the last thing I wanted to show you is, and again, I will not discuss this in details because it's not the focus of this presentation, but we also developed a logic model to link the barriers and facilitators to the selected strategies and then the intended outcomes. And as Carrie said in one of the first slide, don't skip or don't overlook the importance of identifying your barriers and facilitators, because everything else relies on that step here. If it's the foundation for everything that follows. So if you take the time to do it right, your strategies and then your outcomes will be much more effective. So now back to Carrie so she can present the second project.
Yeah, so how we used sort of these frameworks and these ideas in Child Bright Coaching. So Bright Coaching is a project that is focused on parents who have children or caregivers. So who have children who are preschool aged with suspected developmental delays and are on a wait list. So it's a program while they're waiting, either for diagnosis, assessment, or services, any of those. And really what we're trying to do is figure out what the barriers and facilitators are to implementing this new parent coaching program in 4 different provinces. And currently we don't know of any coaching programs for this age group that exists. So it is sort of considered a new, we're trying to implement something new. And it is a virtual coaching program, just to be clear. And it really covers a whole range of topics. There's 10 topics that we cover. And we now know it's evidence-based that family resilience and parental stress was quite a bit lower. So family resilience was up and parental stress was lower, which is great. Why do we need this? Because waitlists are long and parents need that support during waitlist, because that is oftentimes the hardest time. As you know, early intervention is important. You know that all of this is super important, but you don't know where you are or what you should do while you're waiting. So it can be quite a stressful time. It can be quite a difficult time for parents. And also sometimes you can find that they're not even on the right wait list. We found that quite a few times in sort of our local context, that people they haven't even accessed the right wait list. So they're waiting on a list, but it's not the right one. So really some of that system navigation piece as well. So really helping people navigate through that. So how did we collect barriers and facilitators? But the first thing is I wanted to say that we didn't just use the CFIR, and we also use the theoretical domains. We'll get into that just a tiny bit, but not really. We didn't just use them once we've collected things. We used them to make sure we were asking the right questions. So before we went into ethics, before we created our interview guide, we looked at the different sort of pieces of it and went, are we asking questions about how the program might align or not align with a mission, right? Because if we aren't asking those questions, then we don't know if that's a problem or not. Are we asking questions about, is there a tension for change? Do people think that this is an important thing? Because again, that will guide us, and sometimes it'll guide us to a barrier, sometimes it'll guide us to a facilitator. But really, we need to make sure that you're asking questions, and not every single, sort of little thing is going to be relevant to your project. But that framework makes sure you're not forgetting something that is very important for you to ask, so that you can really implement this well. So we actually did do a scoping review. We had informal conversations, and then we held focus groups. And what did we do with that information? Well, we took that information from our focus groups, and then we put it into the theoretical domains framework. We're not going to go into that, but just for clarity, theoretical domains is really good for sort of individual level barriers. And that's the way we broke it down first. But then we found we had a whole lot of things and a whole lot of different things in the environmental context. So in this environmental context bucket, that we needed to break down more to be able to deal with it. And that's where we brought in the CFIR, so the Consolidated Framework, because this one is really good about sort of system level, organizational level, that kind of piece. So, and I just wanted to talk about something Catherine sort of alluded to. So we had to really, because we started this process and then we went, okay, we need to really break down our levels, what level of the system we are working in for each conversation we are having. Because sometimes the outer setting is like the federal government and the inner setting is the provincial government. Sometimes the inner setting is, or the outer setting is the provincial government and the inner setting is an organization. Sometimes the outer setting was an organization and the inner setting was a piece of that organization that was looking to implement it. So really being super clear at what level in the system you are working at, and you can use that same framework in every level, but you need to, in your brain, separate them out, because it'll matter later on when you're trying to implement strategies. So really thinking about the level in the system you're working and how to separate those levels in different ways, but using the same framework. And then really we threw all of these things into buckets. So I have a quote here, and I'd love you to put in the chat, like, where do you think it fits? So we don't have the latitude to add more staff because we are under restrictions with a service agreement with a government agency for our funding. Anything we do is often because donations are allowing us to do that. So where do you think in the CFIR you might put that? What bucket would you throw it in? Throw it in the chat. Outer setting, yeah, outer, yeah. Okay, and does anyone have a further breakdown? In that outer setting, which one of those do you think would, yeah, financing, external pressure, yeah. Policies and laws, yep, absolutely. Systemic conditions, yep. And you'll see that often you don't have agreement where it should fit. And sometimes it might fit in various places. So sometimes you might do something called double coding. So you throw it in two buckets. In this case, we threw that into the financing bucket because we weren't sure if it would be government, which is why we didn't put it in policies and laws. But it depends, depending on your thing, you might put it in policies and laws because you might go, oh, I need to change government policies. So a lot of times also these buckets are going to change slightly depending on what you do. And also don't be scared to add buckets. Sometimes you need to add buckets because there are buckets that don't exist in here that sometimes you need. Okay, next one. But it's difficult to, the next quote, okay? So, but it's difficult to balance. The more time we put towards that, the less time we have towards the diagnostic work, which makes wait times even longer. So just trying to find a balance in how we can do that. So where do you think that might fit? Where do you think that might fit in the CFIR? And again, there's no right or wrong answers. You as a team need to sort of think about it, consider, and make sure that you're all, especially if different people are coding it. Yeah. So inner setting, yep, absolutely. Available resources, individuals, individual barrier. And again, there's no right or wrong answers, and all of you, you know, there are definitions for these things that you can go into, but also this is meant to help you organize. It is not meant for anything else. So if it's not helping you organize, then it's not doing its job. Systemic conditions. So we put it under, here, we put it under relative priority. But yes, it could also be compatibility, could be systemic conditions, could be available resources, right? Certainly for us, what was really important is that, and this is something that really changed how we thought about our project, is that there are going to be places in which case they aren't going to be able to hire people in-house because it will be perceived that that's taking clinicians away from diagnosis, right? So that's why we put it as relative priority. It's like the priority for that organization is to get people off the wait list. Therefore, them having this program may not be something that is high on their priority list. So thinking of different ways we can support using different clinicians, using different people who are maybe not clinicians to be able to run this program so that we're not taking away from that system that is trying to get people off the wait list. So really, again, balancing. And again, no right or wrong into this. Okay, last one. I just think virtual, I think, is incredibly flexible. In general, it allows for a lot of people to participate in things that they might not generally be able to participate in, but families are still going to have other challenges and barriers like childcare and balancing family needs. Innovation, you're right. Actually, I put inner setting up there. Sorry, that was a mistake because I copied the slide over, but yes, it is about the innovation. You're right, Gabriella. Absolutely. And in this case, we specifically talked about relative advantage. So compared to other things that are not virtual, there is some things that are going to be better. Also, there are some things like barriers, like the childcare and balancing the needs of the family that are going to be harder because they're doing it within their homes oftentimes. So it's tricky, but excellent. So yeah, so really, and there are all sorts of ways you can learn how to code, but really it's about, as a team, deciding on what those buckets are and how you're going to code, and then adding buckets or taking away buckets that you don't need. So from all of these CFIR, we didn't end up having things in communications, for example, or in values and beliefs as much as we had them in financing, partnerships and connections, things like that. So really thinking about that. So back to our buckets. So now you have all your things in buckets. You have them all organized in your CFIR, nice little buckets. And you have, okay, these are all the things. And you can read all over all the quotes or comments about funding, all the quotes or comments about policies and laws or relative priority. Now, what do? You're going to have way too many to be able to tackle them all. So then it's really looking at what buckets can you actually control? What buckets can you move the needle on? For example, natural disasters like critical incidents, probably you can't have control over. So that's where you just pause, take a breath, wait till that goes away, and then jump back into implementation. So really looking at what is your locus of control, what can you control? And one of the other things, so two things I would say is, what can you control, but also what are some quick wins? Is there things that you can do quickly that will make the team feel like things are moving along? Sometimes, hopefully, those are quick, easy things. And the second thing is really looking at your barriers and your buckets and going, and what are the things that if I change will really push the needle? So for example, in our Bright coaching, we know funding for new positions is going to be a problem. If we could find that, if we could push that lever, we will have most of the other barriers we can deal with a lot easier, but that one's a big one. So really thinking about what are some quick things so the team feels some confidence, can get things moving. And then what are the things that if you dive in and actually can change that in some way, you can really make implementation happen. Okay, so some key messages. Catherine, I'll do one, then you can do one, okay? So the first one is theories, models, and frameworks are useful guides. You do not have to use them. They are, again, buckets, places to put things, and then you can assess the bucket separately. All right, Catherine, over to you.
Yeah, like we said before, you can use multiple theories, models, and framework if they serve different purposes. So the goal is not to be, scattered all over the place, but really try to find what is best for you, for your project, and for the context or the settings of your project. So find what works best for you, consider the different options, and just don't take what other projects are doing. Really think about what will serve you best.
And in addition to that, you can use the same framework or model or theory in different times in the project. So using it to create our questions, then using it to assess the barriers and facilitators. So you can also use that, like do that backwards as well. And it can be confusing to know what to choose, but you can learn and borrow from other projects. So if you have other projects, that's why sometimes a quick literature look, what did they use and how were those outcomes or were those barriers and facilitators similar to what I'm thinking I will get? Yeah.
And you only need to know one or two theories, models, or frameworks. You don't have to know all of them. You don't have to use all of them. Learn some of them and then how to use them, and then go from there. Don't get lost, because it's easy to get lost.
Okay, now it's your turn. Questions, discussion. Anybody have anything? Delia, yeah.
I just wanted to say, huge thank you for that presentation. It's always great to see these theories, models, and frameworks in action of how do you actually use them. So my question is for someone that's just starting to be able to get into using these. How did you bring your team along with you as you started to use something like CFIR that has so many different pieces? It's weird terminology. What were some of the strategies that you used to make sure that that could be included as part of your team?
I can start on that one. We started with the theoretical domains framework because it felt more accessible. That felt easier. People understood it. It's a little bit easier to sort of get your head around if you're new to implementation science. However, what we found in using that is there was a lot of stuff in environment and the context and environment box that we needed to break down further. So that's when we went to the CFIR. So we started with something easier, got practice at sort of coding and figuring that out. Then we took that one bucket and went, okay, we need to break that bucket down further. We did actually end up going and coding everything to the CFIR eventually, just because we thought it would be a useful tool. But I still refer to both. I refer to the TDF coding and the CFIR coding. But really it's just starting, and it's getting there and taking out quotes and talking about them in a team meeting and going, this is where I would put it. What do other people think? Right. And it's just, a lot of it's just pulling a quote and trying it out and not being worried, not being too scared that you're going to put it in the wrong place. I think that's the biggest fear people have to get over, especially because implementation is different than a lot of the other sciences. There's no like this clear-cut definition, because it's quotes from people who have biases and who have different information and different lived experience. And so it's also like you're also sometimes trying to guess what they actually meant by that. Hopefully you can ask them why in an interview or focus group, but if you can't, you're going off of what is there, and you try and have as little as possible, like make as little assumptions as possible, but it's still a very, very much a process of agreeing as a group. Catherine?
Yeah, and for us, it was kind of the opposite. So we were originally supposed to use both the CFIR and the TDF. So we were supposed to focus on the TDF for everything that's related to the individuals, and then the CFIR for the context. But as we were working a lot with students, so a summer student and then an internship of one session, it was very difficult for them to master both frameworks. So we kind of dropped the TDF because the CFIR was allowing us to have a broader perspective. So we were able to analyze, all the different layers. So again, just being comfortable with adjusting your plan, dropping some of those frameworks if they don't work for your specific needs at the moment. Yeah, I think that's what worked for us. So keep it simple.
Yes, keep it simple and use them as you need them, and change them as you need them. I mean, harder to publish on the CFIR if you add and subtract buckets, but if you're not trying to publish on the CFIR and prove it worked in your project, then add and subtract buckets as you wish. All right. If other questions come up, we can certainly, oh, Celia, yeah, go ahead.
I always have more questions. Curious on when you said that there was new people coming onto your teams, and how did you introduce that you were using CFIR to some of these new members, and how did you kind of explain it and get people to understand what these different domains were? Was it more formal training or ongoing, or just always curious on some of these processes, because it can be a bit overwhelming when you first see some of these things.
Yeah, I guess for us, it was really ongoing hands-on because we already had collected the data. So we had the data, we had their framework, and I was like, play with it. And then we'll sit down, we'll talk about it. But just take this data, look at this framework, see how it fits, and then we'll discuss afterwards. I decided to use a very hands-on approach with them because then having something very, theoretical, just explaining the framework didn't really make sense. So we did go through each domain and then each constructs, but as we were playing with the data, and as you saw, we had the mural board with the sticky note. So it was very easy to just play with it and then try to have fun.
We had our postdoc watch the recording of the Center for Implementation training, was sort of the first piece, and then we sort of jumped into and then we sort of just jumped in as a team, and I wouldn't say that all of our team is still super comfortable with it, and that's okay too. Yeah, Corinne.
Yeah, thank you both so much. This was such an engaging session. I really appreciated learning a lot from you. I just was curious if you had just some, comments around, similar to what Celia had asked, but I'm just curious about PWLE engagement in this process. So if you had some good engagement strategies that work that you found help to facilitate all this wonderful work that you've been doing.
I find often PWLEs jump into it without with less problem. And I'll tell you why. It's because there's not this assumption that you have to get it right. And there's not this assumption that it's this scientific thing that is so scientific and like you have the, like, I think
that there's a wrong answer.
Yeah, as parents, we don't have a lot of right, wrong answers. It's all sort of, wow. It's all sort of gray. So in my experience, it wasn't a big problem. I will say that our team has a bit of an advantage that I've probably, other than our specialist, Andre, who's amazing, who's our implementation specialist, I'm probably the one on the team who has the most experience in terms of practical stuff because of all the training. So, and I come at it very much and like change it, use it, drop it, whatever. Like I'm a very practical person in terms of that. So I think that helped as well. So I think coming at it, not from a scientific side, but as we're throwing things in buckets, they might move around. Let's try things out. And when at the end, you're always going to take a look at a bucket and go like, oh, that one, we missed that. We ended up putting all those things about, I don't know, whatever it is, like racism in that bucket, but this one somehow ended up in this bucket. So we're going to move it. Like you're always going to do a double check to go like, do these make sense in a bucket? And sometimes you're going to have to take that bucket and split it up into 3 different buckets. Because even though it's like policies and laws, it's like, okay, but like, is that at the federal level? So that might be one thing. Is that at the provincial level? That might be one thing. Is that at the municipal or organizational level? That might be one thing, right? So don't be scared to also like take one bucket that's big and split it up as is useful. Yeah.
Thank you. It's great.
Yeah, we're just about at time, so I don't think we have time for any more questions, but we got the future sessions in there. We did want to show our references because we did not create these frameworks. We use them, we change them. Don't tell maybe these people that, but but yeah, and any other last comments or questions, feel free, but otherwise feel free to head off. Thank you so much for joining us.
Yeah, I just wanted to say a huge thank you to Carrie and Catherine. This has been a great session and spurred lots of different ideas. And hopefully everyone can join us again on June 19th, where, as was mentioned in the talk today, a lot of people think about education and training as something that we always need to do, but there's way more to it than that. So we're going to delve into implementation strategies in the next one. But again, huge thank you to Carrie and Catherine for the presentation.
Thank you so much.
Thank you.
Thank you, everyone.